Hi, I'm Brian Prescott with PCCA. I'm here with Dr. Brian Futrell, wound
Hello.
specialist. Dr. Futrell, I would love to talk about wound care and what I consider the most important part of wound care, and that's nutritional support.
Definitely, please.
First consideration that I have when somebody calls me, I ask, what is the nutritional status of the patient? I want to make sure that they're getting proper vitamin A, vitamin C, zinc, copper, and selenium. What am I leaving out?
Well, protein intake is exceptionally important, and obviously we're talking about a large proportion of diabetics, so glucose or glycemic index control is exceptionally important, and at really ultimately looking at the patient as a whole person, we have to look at all factors.
When do you address nutrition in your patients?
Hopefully before they walk in the door, right? Because ultimately, a lot of what gets these patients into trouble is nutrition. How many type 2 diabetics do we see walking around that run 10 miles a day and have a 30-inch waist? It's not the average patient that we see. They're already nutritionally challenged. And one of the biggest lies in the United States is the idea that an obese person is well-fed. They're not. They're calorically challenged. They have plenty of calories, but they're nutritionally deficit. So that process starts early, and unfortunately, as the disease process progresses, so does the nutritional deficit. Okay? And ultimately, what we're trying to do is from the inside and the outside, with all the products that we're talking about today, we're trying to influence the physiology of the wound, both nutritionally and chemically. And that can only be done from both ends of the spectrum. Now, I will put out there that a lot of you who manage very complex disease states, like diabetics with nephropathy or renal disease, you know that chronic disease can often limit what you can do nutritionally. And that's where myself as a wound specialist gets involved to try to introduce nutritional components like collagen into a wound directly, where the body can still utilize it. But again, that's where we move the science into art, and that's where the two of us have to collaborate.